Today on Your Life A to Z, we have...
March is Colon Cancer Awareness Month, and regular colorectal cancer screenings or testing is one of the most powerful weapons for preventing the disease. Joining me are Dr. Nelson Lim and Dr. Mankaval Sachdev from Mercy Gilbert Medical Center. Thank you for joining me. First of all, doctor, tell me about colon cancer and who it affects.
All right. So first of all, thanks for having us. So on behalf of Mercy Gilbert Medical Center, we just wanted to make the public a little more aware. Like you said, March is Colorectal Cancer Month. And first of all, colorectal cancer is cancer of the colon and rectum. Its peak incidence is people usually in their 50s, but sometimes if you have a family history, it can affect people even before they're 50.
And you were saying, too, I mean, this is something that affects men and women should go get testing done.
That's correct. It can actually affect men and women both equally. Okay.
And what are some of the signs and symptoms that people could be experiencing before they go in for a test and not know they suffer from this?
So the signs and symptoms are actually non-specific. Some people can have rectal bleeding, abdominal pain, change in bowel habits, constipation, but again, there are people that actually have it without any symptoms at all. And there's some alarming statistics out there, actually, and there's about 150,000 cases of colon cancer diagnosed per year. And about a third of those people actually pass away from complications related to colorectal cancer. And so it's actually the second leading cause of cancer-related deaths.
So how can someone out there find out if they do have colon cancer?
Right. So that's by having a procedure called colonoscopy. And so what that is, it's a flexible endoscope that's placed inside the rectum and colon, and it looks for something called polyps. I think we've all or a lot of us maybe have been to a dermatologist or a skin doctor, and they kind of freeze and burn little things off of our foreheads and so forth. It's the same concept inside the colon. We have little growths that if left in place 5 to 10 years, it could potentially develop into something significant like a colorectal cancer. And so with these tools, we go on there and remove them before they can become something significant.
Now, doctor, your hospital is one of the first in the region to get this new technology. Tell me about the third eye retroscope.
So the third eye retroscope is a new device that we put through a scope that is a separate camera which allows us to look backwards as well as forwards. The anatomy of the colon is that there are a lot of folds present throughout, and sometimes polyps like to hide behind folds. And with the scope that looks forward, we're only able to see in front of us. This camera goes through, and there's a video here where you have the colonoscope coming out, and the third eye is popping through there, and it goes backwards, and as you'll see, there's a lens and a light, and now it illuminates the polyp that's behind the fold there. We're going to play this again just to kind of show, but the scope will be coming out. The scope is a black tube with the two lights, and then out of it, the third eye pops out, and it reflects backwards, and you'll be able to see behind the fold. The reason this is an advantage for us is that up to 20% to 23% of polyps can be missed because of where they're hidden. And so this lets us get a better look at those blind spots, if you will.
This is such an important test for people to do. And we were talking about earlier, you're sedated, you're put under, so people really shouldn't be afraid to take this test and make sure that they don't have any polyps in there.
That's correct. You know, the technology and the experience has gotten much better over the last 10 and 20 years, and the majority of patients are actually sleeping like a baby throughout the procedure. And if anything, it's actually maybe psychologically painful, of course, the thought of having a long, flexible endoscope inside you, but again, it is not a physically painful procedure, and you're asleep for the duration of the 10 minutes.
Yeah, and how long typically will this procedure take?
So a colonoscopic examination takes between 15 to 20 minutes typically. Most of the time is spent getting you ready, giving you your IV, putting you to sleep, and then the procedure itself is only about 15-20 minutes. If you add a third eye to it, it's about 20-25 minutes. But I also want to add the third eye is a really good test, but we reserve it for those people who have high-risk anatomy or high-risk history. In the fact, people who've had a family history of colon polyps or they themselves have had polyps, those are the ones that we do that for.
Okay, but you would suggest everyone out there who's watching this, 50 and older, man or woman, should go have this test done?
Yeah, absolutely. And if you have a family history, 10 years before the person in your family was diagnosed. So if your mother had colon cancer at the age of 52, then you would go at 42.
All right, well, thank you so much. And of course, this technology now is at Mercy Gilbert Medical Center. So we're so glad you guys came in, and it's a lot of great information for people out there.
Thank you.
All right, thank you so much. And of course, for more information about Mercy Gilbert Medical Center, just visit them online at mercygilbert.org or call the number on your screen.